In this section, we're going to talk a little bit about vaccines and how they have really dramatically improved public health, but how people still debate about them to this day. So, pseudo-celebrities and pseudoscience, the great vaccine debate. I think it's important to start with what have vaccines done for us. So in this image here, we're looking at the names of a number of infectious diseases that used to be relatively common. So what this in red, this bar is telling you how many people got sick every year during the 20th century. So during the 1900s in the US, over 500,000 people a year got measles, right? So that's what this is. In orange is the number of people who got those diseases in 2021 in the US. And then in the green is the percentage decrease. And you can see that these vaccines have really decreased the amount of people who got sick by 99 to 100%. So these vaccines have really eliminated these dangerous diseases from our country. And that sounds great, right? There's hardly any measles. There's, nobody's going to get smallpox anymore. That's awesome. But the problem is when we don't see these diseases anymore, we don't experience them, we don't have that firsthand knowledge of what it was like, we can sometimes get complacent and forget why we still vaccinate. If the diseases aren't around really that much anymore, why do we still vaccinate? So there's a couple of things to remember. The only disease that has ever been eradicated from the planet, a human disease that has been eradicated from the planet, is smallpox. So all of these other infections are still present. Are they present at high numbers in the US? No. Do we have a lot of people who travel in and out of the US every single day to and from countries where these diseases are a lot more common? Yes. So it's really important that we maintain vaccination status in the US to prevent these diseases from taking hold in our country. And it's really important that we do the best we can to assist other countries in vaccinating their populations to prevent the diseases from maintaining a hold in those areas. So vaccines have done a lot to reduce the numbers of infectious disease. So what do these diseases really do? Well, first we'll talk about smallpox. So smallpox, like I've said, is the only human disease that has ever been eradicated from the planet. It first emerged in humans in, we think, about 10,000 BC. And during the 1700s, it was killing an average of 400,000 Europeans a year, including 5 kings and queens. When smallpox was a more common infection, it was responsible for about 1/3 of cases of permanent blindness. Now, the dangerous thing about smallpox, anywhere from 20 to 60% of infected patients died. So it wasn't like you had an itchy rash. It was like if you had 5 people in your family, at least one of them was going to die. So that's, think about your family. You have 5 people in your family, one of them's going to die, at least. Maybe 2, maybe 3. And it's probably going to be one of the children, because 80% of infected children died. In the 20th century, scientists estimate that anywhere from 300 million to 50 million people died. And we're talking about a disease that was eradicated in the 1970s. So nobody died in the 80s or 90s, but still there were that many deaths in the 20th century. And you can see it's nothing like chickenpox. These people have blisters all over their bodies. You can see here on this child that some of the blisters have started to merge into giant blisters. This is a horrible disease. Diphtheria is one that we don't really have in the US anymore, but we do again see in other parts of the world. It's a bacterial disease that the bacteria produce a toxin, and the toxin is what causes the symptoms. It was first characterized, a really long time ago, and what we tend to see are a couple of classic symptoms. One is this really intense swelling of the neck. They call it a bull neck. The other is this yellowish patch right here in the back of the throat This is basically a collection of tissue damage, immune response produced by the bacterial toxin. They call it a pseudomembrane. And again, it looks a lot like you might think those patches that you get with strep throat, but underneath here, the tissue is all raw and kind of bloody. You can kind of see it along the margins here. But this membrane can actually grow and cover your windpipe and cause you to suffocate to death. So serious respiratory issues. If it gets down a little bit lower into your respiratory tract, it can cover up your windpipe. Patients will experience fever, tiredness, just classic infection symptoms. But in the 1920s in the US, 100 to 200,000 perhaps infected per year, 13 to 15,000 deaths. So it's a dangerous infection. Measles is one that comes and goes in the US, especially with people who decide to not vaccinate. Measles is still relatively common in other parts of the world. And so what we tend to see is that there will be an imported case. So somebody will bring in measles from another country, whether they're a traveler to the US or they're a traveler from the US who has returned. That's usually where it comes from. It's believed to have been introduced to the human population around the year 500 or so. You can see this child has a rash all over the body, fever, cough, rash, but there's a high rate of secondary complications. And usually what we see with secondary complications of measles is encephalitis, so swelling in the brain, and that can be fatal. In 1529, so as the Spaniards especially were coming to what we now call, the US and Central and South America, they brought smallpox with them. So this part of the world didn't actually have smallpox until the Europeans brought it. And because this part of the world never had smallpox before, the native and indigenous peoples who lived in these areas were really, their populations were absolutely destroyed by smallpox. Just absolutely destroyed. And then other diseases came through and got everybody else. So in 1529, measles killed 2/3 of the Cuban natives who had survived smallpox. So these are not minor infections. It killed 20% of native Hawaiians in 1850. And estimated infections 7 to 8 million children annually before the development of the vaccine. So mumps is one that maybe isn't fatal, but it does have lifelong consequences. When a child or when any patient has mumps, you get this really intense swelling of the salivary glands. So the virus that causes mumps goes to different glands in the body. So the salivary glands are really common, and you can see the swelling in the neck of the patients. But there are complications that can be more harmful. You have lots of other glands in your body as well. The virus can go to the testicles and cause testicular swelling in some of the glandular tissue there, and that can lead to permanent decreased fertility. It can also go to the ovaries and cause ovarian swelling that can be associated with fertility. And in more serious cases, you can have patients who develop meningitis, which is a type of inflammation of the membrane that surrounds the brain, or inflammation of the brain itself. Finally, in patients who are pregnant that get mumps, you can have spontaneous abortion, so the fetus will die, and you can have hearing loss. So again, it's not just, my neck is a little bit swollen for a couple of days. There are really significant consequences here. Pertussis is sometimes also called whooping cough. So pertussis is the scientific name. Whooping cough is the kind of just name that most people use for it. Outbreaks were first described in the 16th century. And as you might guess from the name, it causes a cough. And again, you might think, well, coughs aren't that severe. What's the big deal? Well, it causes a deep cough a whooping cough that can cause fainting, vomiting, broken ribs. It's a major cough. Sometimes, though, infants don't cough. Instead, they just stop breathing. Because what's happening here is there's a bacterium that's gotten in your body. It also produces a toxin, just like the diphtheria bacteria. And that toxin basically starts killing the cells of your lungs. And so your lungs fill up with fluid and pus, other infectious material, and you have to try to cough to get it out. It can lead to what we call a pneumothorax. The other name for that is a collapsed lung. So it's a significant disease. For the most part, older children and adults tend to recover, but we do see very high fatality rates in infants. So when you're vaccinating yourself, it's not really about you. It's about protecting those who can't be vaccinated, because infants don't get vaccinated for the first time against whooping cough until they're 2 months old. So during that first 2 months of life, if they get whooping cough, there's a very, very high chance that they will die. So what I have here is a video of a child with whooping cough. So he's a little bit older, not an infant. And you can actually hear, it's the characteristic cough. It's not like it's a deep cough, and it's followed by this really kind of weird, strong inhalation of breath, because when they're coughing, they can't breathe. And so when they finally get the chance to breathe, they do a huge inhalation, like, and that's the whoop. So you'll hear that in this patient. So you see how he collapsed after that, how just exhausting it is to have to try to breathe. So every time he's coughing, he can't breathe. You can see it in his body that he's not able to breathe until he can finally and get some air in. It's a really horrible disease that is easily preventable by vaccines. Polio is another viral infection, and this is one that world health officials are really close to eradicating. There are only a couple of countries left in the world that still have naturally occurring cases of polio. So, it's fewer than 500 people a year usually get polio worldwide. Worldwide, 500 people. So this is one that's kind of on the list of maybe this will be the next one that will eventually be eradicated. So with polio, the challenge is a lot of patients don't have any symptoms, but 1% or so will get paralytic polio. It damages the nerves and the nervous system, and so patients can become paralyzed. And some of the areas where patients can become paralyzed can include the muscles and nerves that control the way you breathe. And so if you ever look up an iron lung, patients who've had polio sometimes have to spend the rest of their lives in a machine that helps them breathe, called an iron lung. So this is Franklin Roosevelt, who was the president during the Great Depression, and he was paralyzed because of polio. Sometimes he could hold himself up to stand, but he was more comfortable in a wheelchair. But during that time, during the Great Depression and during the lead up to World War II, especially during the early parts of World War II, it was really important for the public to feel like our president was strong. And of course, being in a wheelchair, that would not have been seen as strong. And so most photographers were actually very respectful of that, and they mostly only filmed him from the waist up. So the majority of the American public did not even know that their president was paralyzed, or at least had some disability in terms of trying to walk. So it destroys the motor neurons, leading to paralysis, and of course that can lead to death if it destroys some of the neurons that help control the muscles that allow you to breathe. Rubella. So we have measles, mumps, and rubella that are given in one vaccine. So rubella is sometimes also called German measles. You see it has a rash very similar to regular non-German measles. And complications are similar to those other diseases: fever, lethargy, maybe you could get meningitis. But actually this one is pretty mild. So, then why would we really vaccinate against it if it's really not that big of a deal most of the time? Well, because when rubella is acquired during pregnancy, it can lead to really significant complications, including miscarriage or stillbirth, low birth weight babies, babies who experience blindness or deafness or both. So here you see a child who has basically big cataracts in the eyes, probably little to no sight because of congenital rubella. They were born with it. Cardiac problems, it can cause significant mental defects. So it's important to vaccinate against rubella to protect the fetus. Okay, so hopefully after seeing all of that, you maybe have an appreciation for why vaccines are important. All of these diseases are dangerous. And of course, this is not all of the diseases that we vaccinate against, but these are kind of the big ones that used to kill a lot of people in childhood or affect children.